Okay, so this is the coronavirus 2019 presentation. I am Brett Hayner, the Emergency Preparedness Coordinator for District Health Department number 10. Okay, I'll give you a little bit of background. What is the coronavirus? It's a family of viruses. So example, a common cold, SARS, and MERS were all coronaviruses. So it's a coronavirus is not something new, but this COVID-19 or the SARS-CoV-2 virus is new, and we'll talk about that here in a second. Also, it is similar, but it is not the flu. So they are totally two different viruses. They act similarly, they're transmitted similarly, and they have the same or similar symptoms, but they are two entirely different viruses. So you may hear two terms used for this disease. And just so you're aware, SARS-CoV-2 is the actual virus, and COVID-19 is what they named the disease. So another example would be H1N1 is the virus that causes the disease influenza. So H1N1 flu, SARS-CoV-2 is COVID-19. Now, most likely the origin of this disease is a bat. And that's because this COVID-19 disease, or that SARS-CoV-2 virus, is found in bats. It's a beta coronavirus, and those are normally found in bats. But we may never know because it started in China, and it's difficult to get information out of there. But probably what happened is a bat either bit an animal, or that animal was like rooting around under the bat, like in their droppings, and somehow ingested it. And then a human probably ate that animal without it being cooked properly. And then that's how the disease started. But like I said, we may never know exactly why. Okay, why the concern? One thing is that this virus is brand new. And because it's brand new, we don't have a vaccine. So without a vaccine, everybody in the United States, or the world for that matter, is at risk for becoming infected. Another concern is that we don't know at this point how bad this will actually become. So both from an illness or a fatality rate, and I'll talk about that a little bit in the next slide, but also from the healthcare system. So the biggest concern we have right now, and why you're seeing a lot of the restrictions and places shutting down for business, is that we're trying to, and you've heard this term, flatten the curve. So what will happen is, if you pick the county, the hospital in your county, and they have an extra 10 patients because of some disease that's happening, it might be tough for them, but they can more than usually handle that. But if we're talking an extra 200 people that come in on a given week, they can't handle that extra overload. So what we're trying to do is spread this disease out so that only a few people are infected each day versus hundreds. And then in terms of the pandemic, early on, the media was using that like, oh no, we're about to become a pandemic, and then the sky is going to fall. But I just wanted everyone to be aware that that's really not the case in terms of what pandemic actually means. And to meet the criteria of a pandemic, you really only have to have three things. One is it has to be a brand new virus. Two, it has to spread human to human. And three, it has to spread basically around the world. So if it was just in the United States, we would call it an epidemic. But if it's spreading around the world, we call it a pandemic. So if you meet those criteria, you will have a pandemic, just like we had with H1N1 back in 2009. So it has nothing to do with how bad the virus is going to be, or how severe it is, how many people will be infected or killed. That has nothing to do with whether it's determined to be a pandemic or not. Okay, what is the current situation? As you all know, this started in Wuhan, China, but right now we have level 3 travel notices for China, Iran, and most of Europe. So what that means, and that's changed over the past couple weeks, but what that means right now is people, foreigners from those countries are not allowed to come into the United States. Now, if you're a US citizen, there are ways that you can get back in, but you would be put through a rigorous screening process and you'd be quarantined and all that stuff. But those foreigners are not allowed to even come into the US from those countries. And then you see that bullet there. It says see the CDC and MDHHS websites for current world, US, and Michigan numbers. I don't include those in this presentation because it changes every day. But I did look yesterday, and by the way, they changed those numbers for Michigan at 2 p.m. So the numbers I'm about to give you are already out of date. But as of 1 o'clock today, when I wrote these down, here were the numbers. So in the US, we have 10,500 cases and 150 deaths. And in Michigan, before 2 p.m., we had 80 cases and 1 death. So those are the numbers we are dealing with right now. And then you'll see, when you're looking at those numbers, you'll see something called patient under investigation, or PUI. And just so you're aware, for someone to fall into that category, so that's generally someone who we're going to test. To be approved for testing, generally what the healthcare entities are looking for are things like your travel history, contact with confirmed cases, if you're showing symptoms, and have they ruled out other diseases? So like the flu, did they test you for the flu? And if you have the flu, then more than likely they're not going to test you for COVID-19 because they're going to assume you have the flu. But just so you're aware, that's kind of the what we use to judge whether or not someone's a patient under investigation. And then just to give you some perspective, because I get this question a lot, particularly early on when this disease started, was people would say, well, this is nowhere near as bad as we have with flu. And right now, they're actually right, because flu, on average, kills 50,000 Americans every year. A lot of people don't understand that that's how many deaths we have every single year in the United States. And in some years, it's actually been higher than that. We've gone all the way up to around 80,000 in a given year. The difference in what we're concerned about right now, I already mentioned the curve in overwhelming our healthcare system. But the other issue is that because we have such a small sample size right now of COVID-19 infections and people with the disease, right now we don't have a good handle on what our fatality rate will actually end up being. So when I talk about that 50,000 number for flu, what that actually works out to is about 0.1%, which is 1 out of 1,000 people will die in the US every year because of a flu infection. But early on with COVID, those numbers were looking to be like 3 or 4%. And in epidemiologic terms, that is a huge difference. That's a very large number when we go from 0.1 to 4% when we're talking about death rates for a particular disease. So instead of 1 for 1,000, we're talking 3 or 4 per 100 who would die from COVID-19. Now, again, that may go drastically down, at the end of this, next year, and we're looking at all the numbers, it may be at 0.1%, but it could also be at 6%. And anything above 2 or 3 is very dangerous in terms of our healthcare system. All right, symptoms. They can range from none, mild to severe, and it all varies by person. And as an example, a few weeks ago, I was watching an interview of a gentleman who was on a cruise ship, and his wife, they were quarantined. His wife had severe symptoms. She was really sick. So they tested her, obviously, and she tested positive for COVID-19. And then because he was in the room with her, they tested him. And he, right now, when they were doing this interview, he had no symptoms at all. He felt fine. But when they gave him the test, he tested positive. So there's an example of someone who was feeling fine, no symptoms, but still tested positive for the disease. And then we go, like I said, all the way up to severe, where they can have very difficult time dealing with that virus. Flu-like. The symptoms are generally, the three ones that main ones that they're looking at are fever, cough, and shortness of breath. There are other symptoms, so it's not to say that other ones don't apply, but that seems to be the three that are sticking out. Okay, there's a couple problems when we're talking about the symptoms of this disease, and one is that particularly in the elderly population, the symptoms can lead to pneumonia and then death. So we have had, as I mentioned, the numbers, we have had people die from this disease in the United States. Problem number two is that there's been some anecdotal evidence that people can be infectious before they're symptomatic. So what we mean by that is, like that guy I was just talking about on that cruise ship, he felt fine, but he was infected with COVID-19, and he could then spread it to other people and not even realize he's doing it because he doesn't even realize he's sick. So that's a huge concern from the public health perspective with this disease. So what that means then is it's very difficult to try to contain or stop the spread of the virus, because if we don't know who's sick, we can't do things like quarantines. All right, so this picture is just to kind of show you why we want people covering their nose and mouth when they do things like cough and sneeze. Because this disease is spread by those respiratory droplets. So the issue is, if those droplets then gets in your eyes or your nose or your mouth, you can then be infected with COVID-19. The other problem is there's some evidence to indicate that droplets on surfaces like doorknobs or gas pumps, and you can then touch that doorknob, for example, and then if you were to eat a sandwich without washing your hands, you've now ingested that virus into your body, and then you can become infected with COVID-19. Right now, it's not considered airborne. So it's respiratory droplet transmission, not airborne transmission. And there are some diseases that are airborne, like tuberculosis and measles. And I'll give you an analogy of how that would differ. So my measles or airborne example would be like if someone was smoking a cigarette in your room. So think of like your conference room in your building. If someone smoked a cigarette in that conference room, no matter where you were sitting, you would smell that smoke, because it's so fine that it just permeates the entire room and it's just floating around in the air. So if someone 2 hours later comes into that room, they're still going to smell that smoke that's wafting around in the room. That's what measles is like. An unvaccinated person can walk into a room where someone who had the measles coughed 2 hours before, and that person will get infected with measles. Now that's opposed to my respiratory droplet example is like baking flour. So if you were in that same conference room, let's say you're at the front of the room, and you dipped both your hands in and put your hands together and pulled out a glob of baking flour, and then you were facing the other people at the tables in the conference room, and you threw it up into the air, it would probably get to people, the flour would probably get to people within 6 or 8 feet of you. So it would land on them and land on their table and maybe on their backpack, etc. But for the people that are more than 6 feet away, that flour probably wouldn't even reach them. So that's our example of a sneeze. So in this case, if you can stay 6 feet away from other people, you're more than likely to stay out of that range for contamination. All right, then survival on surfaces. Again, because this is a new virus and we haven't done a lot of research on it at this point, we're basing our information on past coronaviruses. But with those other coronaviruses like MERS and SARS, the virus has been shown to live on surfaces for at least a couple hours, up to a couple weeks. And the latest thing that I had seen from the CDC is they're talking about, and it depends on which surface, but some of the surfaces, it's looking like about 9 days for this COVID-19. But again, that may change as we move into the future and they do more research on it. Okay, cleaning and disinfecting. What products to use is a question that I get a lot of times. And so based on the CDC recommendations, you want to use an EPA registered household grade disinfectant would be fine. Or you could make your own solution. And what they're saying right now is you want a 1/3 cup of bleach per gallon of water. So if you have that type of bleach solution, it should be fine for disinfecting surfaces, whether you're at home or in your office. And then how often to do that? The CDC, the terms they use are routine cleaning and facility policy. And the problem with that is that leaves a lot of gray area. So one person's routine cleaning might be totally different than someone else's routine cleaning. But from a public health perspective, what we want you to do is basically clean as often as possible. You know, whatever is feasible for you to do would be what we want you to do. And because that leads into my next bullet, which is cleaning is important, but it's not a fail-safe. And what I mean by that is cleaning can reduce the exposure by killing or removing a virus. So I'm going to use that doorknob as an example. If someone is infected with COVID-19 and they have it on their hands, and then they open that door, they're now going to contaminate the doorknob. Now, if that is not cleaned, every person that uses that doorknob is going to get COVID-19 on their hands. And going back to my example earlier, if they then eat a sandwich without washing their hands, they're going to get infected. Now, if that person that's contaminates the doorknob, and then 1 minute later we come through and we clean that doorknob, everyone else that comes after that won't be infected because that doorknob's now clean. The problem is it's only effective until the next person touches it. So here's an example. If we clean that doorknob at 2 o'clock and someone contaminates the doorknob at 2:05, and then we don't clean the doorknob again till 3 o'clock, everyone who touches the doorknob between 2:05 and 3 o'clock is potentially, they're at least getting exposed and potentially going to infect themselves. So that's where the recommendation to clean as much as feasibly possible is the way you want to go. Okay, I've got 2 slides where I want to talk a little bit about our public health response and preparedness. So if you weren't aware, the United States has set up quarantine stations in 11 airports, and one of them is Detroit Metro. So early on, everyone that was flying in from countries like China, we would funnel them through one of these airports. And then they would assess them based on the various risks that they would have. And then some of them would be they would be deemed, low risk, and they could go on their way. If they were high risk, they were put into quarantine. So public health was charged with monitoring those travelers. And these are people that are not sick, but they have the potential to become sick. So as I mentioned, the categories were none, low, medium, and high. And if they were placed into quarantine, we placed them into quarantine for 14 days. And that's based on the incubation period. So from the time that person got infected to the time we expected them to get sick, it would be sometime within 14 days. So if it's now been 16 days, we don't expect that you will get sick because no one gets sick after 14 days. So that's the reason for the 14-day number when we're talking about quarantine. Okay, health department contact for someone who's in quarantine, is twice a day. So what we're doing is we're just asking them if they've had any changes to their health status. We're having them take their temperature, let us know if they're running a fever, that sort of thing. Testing for the disease is basically on a case-by-case basis based on those risk factors. But if you are approved for a test, it's just a simple swab test, and the actual test in the lab is 4 hours, but it's taking a couple days to actually get those results just on, administrative stuff they have to do and the backlog of tests that they have at the lab. So it will be at least a day or two before you will find out your results if you are tested. And eventually, hopefully sooner rather than later, and it's happening now, there will be more and more test kits made available. And then eventually there will be enough where every healthcare provider will just be testing everyone who they think who either wants a test or has symptoms. So basically everyone will be getting tested at some point, but right now we are not there. All right, public information. Again, going from a public health response, we're doing a lot with media. So here at the health department, we have a public information officer. Her name's Janine, and she is doing a lot of press releases and doing radio interviews and that type of thing. Trying to keep the media apprised of what's happening. And then we're doing a lot of group stuff like this type of presentation. We did go to meetings. Right now we have, our agency has stopped meeting face-to-face as one of the precautions we're taking, but initially we were doing group meetings, and we're still doing these webinars and that sort of thing. Okay, public health preparedness. Some of the initial measures and recommendations we had were things like hand hygiene and respiratory etiquette. And those are just fancy terms for saying wash your hands and sneeze into your elbow or into a Kleenex. And I'm going to talk specifically on washing hands here in the next slide. Another recommendation is social distancing. And what that means is, like I said earlier, we want you to stay 6 feet away from everybody else, trying to stay out of that contamination zone. And then what's really important is if you or anyone else feels sick, we want you to stay home, because that's what happens. If you're sick, you then spread it to other people. So just stay home, get over your illness before you go back out in public. All right, masks. Currently, N95 masks are only recommended for healthcare people who are dealing with COVID-19 patients. So it's not advised for the general public, basically because you don't really need it. If you're not around someone with COVID-19, you don't need an N95 mask. The other question I get a lot is, do the surgical masks have any benefit? And frankly, no, for a couple of reasons. One is that surgical mask doesn't make a seal around your mouth and nose, so that virus can still get in and around the surgical mask. And the other issue is that it potentially will help if you're the one sick wearing a surgical mask, because then if you cough or sneeze, that mask will actually catch your fluid and potentially protect others. But it's really not helping you a lot if you're wearing a surgical mask just as a precaution. All right, I want to talk about mass clinics and points of dispensing. And first, let me talk about vaccinations. And right now, we're still looking at 12 to 18 months before we will probably have a vaccine. And the issue there is it takes several months in the manufacturing process. Remember, this is a brand new virus, so we had to start from scratch. So they had to manufacture the virus, and then what actually takes the longest is they have to go through their human trial process. So they have to give it to subjects to make sure that it's effective and safe. And if it looks like it's safe and it's working, then they can mass produce it and distribute it to the rest of the population. And that's a key when we're talking about providing the vaccine to the public. Back in H1N1, it was a similar situation. That was a brand new virus. It was a pandemic. So we had to start from scratch. And they can't make 300 million doses of vaccine in one batch. So what happens is they make a certain number, whatever that number is, say it's 100,000 or 500,000, whatever it is, they make that and then they ship it out. And then the next batch is ready the next week, and the next batch is the next week. So because they can't give enough vaccine for everybody, what they did back in 2009 is the government came up with a priority list. And with H1N1, the highest priority was pregnant women. The virus was really hitting pregnant women hard. So we vaccinated them first, and then we went to the people that were next on the list. So more than likely that will happen here. And this time around, it looks like the elderly population is a population that's most adversely affected by COVID-19. So they'll probably be first on the list, and then we'll go to next, and then the next. Okay, I want to touch a little bit on some of the authority that the health department has under the public health code. And the two examples I want to give you is quarantine and isolation and suspension of mass gatherings. So with quarantine and isolation, in case you weren't aware, my health officer under the public health code has the ability to tell an individual or a group of people that they have to quarantine or isolate. And then that's an order that they have to follow. If they were not to follow that, the health department can go to court and get a court order, and then under penalty of law, basically meaning you could be taken to jail if you don't follow the order, they have to quarantine or isolate. And just so you know, not to get too far in the weeds, but quarantine just means if a person has been exposed, but they are not sick yet, they are in quarantine. If someone is sick with the disease, then they're isolated. It's just a kind of a technical way of looking at those two terms. Okay, the other one is suspension of mass gatherings. And that's what we're currently dealing with at this point. The difference is the governor decided to do that for the entire state versus a local health officer doing it for his jurisdiction, his or her jurisdiction. So the governor made the suspension of mass gatherings order for all the schools in the entire state. So again, that's a lawful order. The schools had to shut down even if they disagreed with that order. Again, my health officer would have that same authority. All right, I want to talk, I think it's my next slide is the last slide. I just want to talk specifically about washing your hands. And the reason I bring this up is since I work at the health department, I've been kind of observing other people over the years wash their hands. So like when I'm at Burger King, I'll go in and wash my hands before I eat. And I've noticed other people in those restrooms washing their hands. And I would say 99% of the people that I have observed washing their hands don't do it correctly. So I've thrown a slide in here to hit on a couple points, and then maybe you can then educate your family members and your friends who may not be doing it correctly either. So here are a couple points. It doesn't matter if the water is hot or cold. Whichever one is your preference is fine. The only thing that the water is actually used for is helping to spread the soap around your hands and then to wash it off. One of the questions I get, and I had this several times, is they've heard that, well, you don't want to use hot water because it will open up your pores and then it will let the virus in. That's actually a misnomer. It's a myth. Your pores don't actually change size. And they think where that originated from was people when they were washing their face, they found that using warm water would help with like blackheads and getting that out of your skin. But it's really not doing anything about the pore size. So that's a myth that you will increase your likelihood of getting infected by using hot water. The key here is that you want to use soap. So again, going back to my observations, on a number of times, I have seen guys go in, turn the faucet on with their hand, put their hand under the water for like 2 seconds, and then turn the faucet off. That did nothing for helping to clean their hands, and it could be even worse than not washing your hands at all because they've actually touched the faucet. And I'm going to get into that in my last slide. But in terms of soap, if you're going to wash your hands, you need to use soap. And the reason for that is when you're scrubbing that soap around, the action of the rubbing and the chemicals in the soap actually help release the dirt or virus, in this case, from your skin. So now it's up into the soap suds. And then when you wash your hands under the water, you're washing the virus off of your hands. If you're not using soap, that's not going to work. The next key is you need to scrub for about 20 seconds, because they've shown that people who don't do it for 20 seconds, so 5 seconds, 10 seconds, probably aren't doing it enough to get all of the virus that may be on your hands. So the analogy I use here is, think about, for those of you who watch medical shows on TV, and the actor who's playing the doctor is going to go into surgery. So they walk in and they're holding their hands up, and they get the soap and they scrub their hands really vigorously. They wash off the soap and then they use their elbow to turn the water off. That's what we're talking about. So when it's clean, don't touch the faucet again with your hand. What you want to do is you use the paper towel. Because, like I talked about earlier, if you turn on the faucet with your hand, you do the correct steps, you're using soap, you're scrubbing for 20 seconds, you wash your hands off, get the soap off of your hands, and then you touch that faucet again to turn the water off, you just put whatever viruses are on that faucet back on your clean hands. So you don't want to touch the faucet. You want to use the paper towel. So you dry your hands with the paper towel and then turn the water off. And it's the same with.
Hey, Brett, this is Janine. What if there's no paper towel? A lot of these bathrooms have hand dryers now, and there aren't paper towels.
Yep, good question. So I'll give you an example. I am in Mecosta County. Big Rapids is my home office, and our Kentucky Fried Chicken has that hand dryer. And what makes it worse is their faucet, the handle, doesn't have any protruding parts, so it's just like round. So you have to actually grab it with your hand to be able to turn it on. You couldn't use your elbow. So what I do, because I like going to KFC, what I do, knowing that, I go past the napkin container on my way in, because no matter what restaurant I'm in, I always go and I wash my hands first. So I just go by and I grab a couple napkins out of the dispenser. I go into the bathroom. I put the napkins in my pocket. I wash my hands. I leave the water running. I pull my napkins out of my hands. I dry my hands off with those napkins. And then I use the napkin to turn the faucet off. And then here's the other key, which my bullet point there is, don't touch the door handle either. So again, in my example at KFC in Big Rapids, the door you have to pull in to exit out. So I just turned that handle with my napkin on the faucet, and then I do the same thing. I use that napkin in between my hand and the door handle to open the door, and then I just throw the napkin away on my way out to order my food. And then my last bullet there, I said, so while we're talking about it, we're in this fast food restaurant, here's a couple other things to think about. What about the fast food ketchup dispenser? Now think about like Burger King. Most Burger Kings will have a pump ketchup dispenser. And what do most people do? They just put their entire palm over that ketchup dispenser while they're pumping the ketchup out. So everybody that's ordering fries at Burger King that day gets ketchup, and they've done it by putting their hand on that ketchup dispenser. And their hand may or may not be clean. The same thing with the pop machine. Now, I know a lot of pop machines have it where you just put your cup under and it empties into your cup. But some of them still have the little button on the top. So if you like Diet Coke, you got to push that Diet Coke button. So again, if we're at Burger King and they have the push button Coke dispenser, everybody that's got Diet Coke that day has touched that Coke dispenser with their index finger. So again, just to give you my example, I use the knuckle of my hand versus the tip of my finger, because then it's on the back side of my hand and it actually won't be touching my big Whopper that I'm eating at Burger King. Okay, so here's my last slide. These are just a couple resources for you to write down. So we've got the dhd10.org is our health department website. We've got lots of good information from there. Janine's continuously updating that. And we also have links to these other sites, but the michigan.gov is our state of Michigan one. So that's where I said earlier in my presentation, if you want to take a look at what our daily numbers are for Michigan, you can go to that site. And then cdc.gov is where you can go to get US numbers, but they have all kinds of information on there. You could literally spend the next 4 days reading through the information the CDC has on their site and still not get through it all. But that's those are all three good resources for you if you're looking for particular pieces of information or fact sheets or what have you. So that is my presentation. So again, I want to apologize for the technical delay at the beginning, but I want to thank you for your time. And what we're going to do now is I'm going to have Christy come back on and kind of talk about how we're going to handle questions, because I know you can type in your questions. And Christy, just as a reminder, I can't see those, so you'll have to read those off to me. But I think you'll also have an option to use the phone. So Christy, if you're available, come back on.
Yep, thanks, Brett. So as a reminder, we're taking questions in the chat function. So you can get to that either through the toolbar. If you kind of hover over the lower part of your window above where the little circles where the people are, there's a button that looks like a text box. You can click that. Or on the top left side of the window as well, you can get to the chat function there. But we do have one question, and it's kind of like a multi-part. So Emily asks, if someone had these symptoms back in November of 2019, could they have had coronavirus? And then could or should they still be tested? And then the second part of that is, could they continue to be a carrier or transmitter of the virus?
Okay, so it's possible that they could have had it back in November or December because we don't exactly know when this started. Probably unlikely, but it's possible. And the reason I say that is more than likely, if it started back, if we had a case or cases back in November, we would have had that curve or that spike earlier than what we currently have, because they would have then been spreading it to other people. So that was one. And then there was should they be tested was the next part of that. And if they aren't showing symptoms right now, there's probably no reason to test them at this point. And then there was a third part of that, Christy?
Yes, it was, could they continue to be a carrier or transmitter?
And that one is an unknown. Again, because this is a new virus, we don't have a lot of data on it, research on it. That's a distinct possibility, but I can't say for sure one way or the other, because we just haven't been dealing with this disease long enough to actually say whether that is true or not.
And that was the only question that's on the chat. I'm not sure if anybody has any other questions, and I'm not on the phone line to take phone questions.
And I'm on the phone too, so I guess if there's anybody who is on the phone and has their phone muted for the presentation, you can feel free to unmute and ask the question over the phone. And then for those that are on the team viewer, the webinar, I can repeat that if I get a phone question. We might have some trouble with multiple people trying to ask the question at the same time, but we'll try to work through that. All right, I'm not hearing any questions on the phone, so how about we'll give it, a couple more seconds for any other last ones on either the phone or the webinar, and if not, we will call it a day.
Sure. And I would just like to say that if anybody has any questions following the webinar or just continued concerns or need, need to connect with the health department at all, they can email us at info, INFO, at dhd10.org. So, and I'll put that in the chat box as well. So, that's where we're fielding these types of questions and concerns regarding coronavirus.
All right, do you have any more written questions?
This is Janine. Actually, I was just going to say too, Christy, you may have already said this, but this presentation is being recorded and it will be put on our website. A link to it will be put on our website shortly. Probably give it a day or two for it to be put up there. And it will be linked to our YouTube page as well. So if anybody wants to share this presentation with others, feel free to do so.
Okay, not hearing any other questions, I think we will call it. Thanks, everyone. Have a good day.
Thank you very much.